President and Chief Executive Officer of Niagara Falls Memorial Medical Center, and I'm here to give you another update with respect to all of the precautionary measures and the emergency planning that the Niagara Falls Memorial team is doing. And as I have shared with you in our previous broadcast, things are very fluid. They change by the hour. I'm also here with Dr. Michael Mitchell. Dr. Mitchell is our Chief of General and Vascular Surgery. We're very fortunate to have Dr. Mitchell's leadership. Finished his residency at University of Buffalo in 1996, has over 25 years of highly skilled experience in vascular surgery, general surgery, minimally invasive surgery, robotic surgery, and any other surgery you could think of. But we're very fortunate to have his leadership, and I'll ask him to speak in a moment. First, we have recently received, in anticipation of the coronavirus outbreak, every hospital in New York State is being asked to develop a plan to increase its bed capacity, its inpatient bed capacity by 50%. So we have been planning on doing that right along. We've had emergency planning that has been ongoing probably over a month now with respect to increasing our capacity in the event that there is a surge in medical cases. So related to that, obviously it affects our ability to provide surgical services, and as a result of working with Dr. Mitchell and other physician leaderships, Dr. Mitchell is here to share with us a revised policy that we are putting into effect, effective immediately.
Thanks, Joe. So earlier this week, myself, Mr. Ruffalo, Dr. Bojella, who's our Vice President of Medical Affairs, and our Infectious Disease Chief, Dr. Bajwa, met to formulate a plan moving forward, anticipating potential surge in patients related to COVID. So as a result, what we've come up with, and as is the case at many centers, we will be scaling back surgical services and limiting it to those which are urgent or emergency services. So we will continue to be a fully functional operating room and endoscopy service, including gastroenterology, infusion services, as well as urologic services. So the misconception may be that no surgical services will be provided. That couldn't be further from the truth. We will continue to take care of patients on a daily basis, because at the end of the day, it's about patient safety. What we're trying to avoid, as is every other facility in this country, is the increased density of not only patients, but families and anybody else that comes in contact with our staff. So of utmost importance is the safety of our patients, our staff, and the community overall. We will be suspending elective surgical procedures until April 13th, and that date certainly will be flexible depending on the situation that arises. Urgent and emergency cases will continue to take place. So our medical staff and our surgical staff have been outstanding through this whole process, and I'm sure we'll step up and continue to provide outstanding service through this very, very difficult time.
So related to this decision today is not only the need to plan to increase our inpatient bed capacity by 50%, but coupled with the fact that there still are not sufficient numbers of test kits that are available in all of Western New York. So you could very well have, as we have discussed, many people in the community and the region that may have the virus but are not known. And so part of it is also making sure that we're not putting our healthcare workers or patients at unnecessary risk. Dr. Mitchell, so like urgent, emergent, we're restricting it to urgent, emergent, it doesn't necessarily mean that elective cases were not necessary. And there's probably some instances where if a elective case is pushed out too far, it could become an emergent situation, correct?
Absolutely. For instance, if, as it relates to general surgery, if we have somebody that comes in and that's been experiencing abdominal pain, whether it's acute or intermittent, that patient will still be cared for and still have surgery done. We're not going to have that patient suffer until this is all over. That patient will continue to be taken care of. As it relates to urologic procedures, if a patient has a kidney stone and they're in pain, they will be taken care of. Patients with a hernia. So the list goes on, but it will not be so strict as to require necessarily an emergency room visit in order to be taken care of. We need to be flexible and keep in mind that patients still do require surgery and patients still do have problems that aren't necessarily going to go away until they do have a surgical intervention for those select patients.
And we also, along with the plan to increase bed capacity by 50%, we have reached out to probably several hundred physicians in terms of helping hands in the event of a surge situation. And we are very, very pleased with the amount of surgeons, physicians, medical physicians, surgeons, other providers that are volunteering to go on that list in the event that we need them to help provide patient care in many of our medical or patient care areas. Dr. Mitchell, is there anything else? I don't want to take up your time. I know you're in between cases, vital emerging cases, and if there's, is there anything else that you would like to share with us?
No, I just very proud of the staff that we have in the hospital and how they've stepped up, and particularly our medical staff as well. They've been very understanding through this whole thing. It's not an easy situation to deal with. It's all brand new for all of us and extremely fluid in nature. And I think everybody's done a great job in getting prepared, anticipating what might come.
And I would tell you that Dr. Mitchell, like Dr. Bajwa, has been available 24/7, 8 days a week in the event that he's needed for advice and counsel, and also for taking care of our patients. And we are deeply, deeply grateful to his passion for our region, our folks, our healthcare workers, and our patients.
Thanks, Joe.
Thank you.
Okay.